Hi guys, Dr. Sullivan from Move Physio, where we help our clients become unstoppable. Today we're going to be doing a case review of something that's really common, which is nausea during pregnancy. And the point of this is not to say that if you are pregnant or your loved one is pregnant that and they're nauseous, that this is going to be the treatment. The point of these case reviews is to open perspective and to give different options for what the common treatment methodology may be. And we're going to be going into some others in the future. So in this particular case, this lady is in her second trimester, extreme nausea, which was creating a situation that was exacerbating nerve pain that was in her pelvis and in her leg. So the nausea was actually a bigger priority for us because no matter what I would do for the nerve pain, every time she would vomit, it would actually increase the nerve pain. So we can't treat the nerve pain until we treat the reason that she's vomiting. So what we ended up doing, so the common methodology for treating something like this, the common treatments are things like the anti-nausea medications and things like that. And there's a bunch of other home remedies and things like that. What we found on her was she had some pre-existing issues between the organ of the stomach and the organ of the liver, and how that was impacting digestion in her particular body. So her liver was very restricted and it was being pushed up, potentially from the growing fetus, but I think this was something that was pre-existing prior to the pregnancy. So as the liver got pushed up, it was actually creating a situation where the liver could not help with fat digestion. So as she would eat things, as it wound up in her small intestines, the bile of the liver was unable to emulsify those fats. So it was creating a situation that was, nauseating. So in addition to that liver issue, she was having some issues directly with the organ of the stomach and how the organs themselves, the stomach and the liver, were interacting. With the stomach, again, being pushed up and creating an issue with the esophagus itself. Literally, every time the stomach would churn to grind whatever she was eating, it would spit up acid into her esophagus, and ultimately again create nausea and vomiting. So there was a lot of periods of time where she was literally just vomiting, bile. She was just vomiting, stomach chyme and acid and bile. She was simply not digesting. So we worked particularly on the stomach and the liver and their interaction with each other, as well as the duct that connects the liver to the small intestines. And instantly, right after treatment, she was talking about how her bladder actually felt significantly better because of the relationship there with the pressure and tension, but also how all of a sudden she could breathe. She was having a lot of difficulty with breath, which is, again, a very common thing with pregnancy, that most women just say, oh, it's just because my stomach's getting bigger with the baby, can't breathe as well. This went a lot further than that, and she's not that big yet. She's only in her second trimester. So this actually created a lot of expansion. Her rib cage was able to move a lot better. Again, that's going to feed into her everyday activities and feed into her everyday movements. So doesn't necessarily have to be treated with drugs, with the anti-nausea medication. A lot of times there's other factors that play a role in this. So I hope you enjoyed this quick little recap of this particular case. I'm going to be posting some out-of-the-box ideas about how to treat different things. So if you have any questions or comments, feel free to reach out. And you can also go on our website and book your own consults directly with us on our site, movephysio.com. Upper right-hand corner, there's a Get Started button, and you can book yourself online to get yourself on for a consult, so we can actually educate you specifically on your needs for your specific body and your specific scenario. Which is, again, that's sort of what sets us apart, is our ability to look at the whole perspective of the individual. Hope you enjoyed, and I hope you guys are having a great day, and